This is a prescription and dispensing iPad program made by Connor Landry called IdealRX. First off, you start off with, of course, the name and the time at the top of at all times to help the doctor out. And it starts with new patient or returning patient. For this little demonstration, we're going to do a returning patient. So you just touch returning patient, and then let's say we have a person named Jack Daniels who has a severe toe infection. You just type in his name into the iPad, and then your patients come up. Click on Jack Daniels, who has his patient ID. What pulls up would be his age, his allergies, medical history, and current medication. The allergies, the medical history, and the current medication can be clicked on to pull up a deeper menu so the doctors can scan through it. Once all that's checked, you can hit prescribe drug at the bottom. This is so the outline of it is real simple, but it can get complicated if you click on it and open it up into more stuff. Once you click prescribe drug, the drug search comes up, and of course has the patient name still at the top. That way no confusion can happen. Let's say if Jack Daniels needed just your normal antibiotic, amoxicillin. You'd search amoxicillin into the search box, and then name would pop up. You can also search by type. Let's say he had some type of allergic reaction to amoxicillin. You can type an antibiotic, and it'll show you the different choices you can have. Once that is pulled up, once you pull up your amoxicillin, you still have your patient name, you still have the correct doc at the top. You pick your dosage, which would be, you can either do 250, 350, 500, which are normal amounts, or you can do other so the doctor can type into their own amount. Once the dosage is picked, this is where you pick how many daily you should do, or other if you want to change it, and how many pills to be prescribed at a time. Again, other if you want to change it. Once the the pharmacist picks all of these options, there will be a final review that the computer does for you. The computer will search to make sure amoxicillin is in stock, that the patient will not have a reaction with any of the current medication. It'll do the search for you. That way, if you happen to miss anything, it'll just clear up anything that you happen to go by. Once that is all done, you'll get a green box at the bottom saying all clear. Now, if that did not work, it would, you'd get of course a red box saying no go. Once you get to all clear, you go to the next menu, which would have just pretty much your rundown. Your patient name, patient ID, what drug, what's the dosage. Once that is all good and all clears go, you can hit dispense order or edit order. Dispense order, of course, that'd be it. The order is dispensed out. Edit order would be just in case you want to make any changes. You can just go to edit order and fix it there. And that'll be it.